Good morning to the Cranleigh community. I hope you are all safe and well. We are here again, and we're in February for a very, very special guest, and actually a guest that we've had before in very different circumstances, because last time we had our speaker, it was at our wonderful Sadiat Beach Club, but we are in different times now, and these are the times we find ourselves in, but we are here with you, and we are so, so, so grateful to have Dr. Hady back with us from the Harley Medical Centre. I know Dr. Hady's also having to, at home at the moment, he's also fitted with his tracker. So good morning, Dr. Hady. It's lovely to have us. Just a little bit of background about Dr. Hady, if some of you haven't met him as part of our community. So Dr. Hady, as I said, is from Harley Medical Centre here in Abu Dhabi, and we're so excited for him to be joining us. He started his education at the American University of Beirut and finishes his speciality in pulmonary diseases and sleep disorders in France. He has a vast experience in asthma, COPD, and cancer of the lungs, focusing on diagnosis and management. He does flexible bronchoscopies for the patients here at Harley Medical Centre. And Dr. Hady is also a specialist in sleep disorders, insomnia, narcolepsy, and other problems sleep related. So as you can hear, that Dr. Hady is extremely busy. But as always, he's always offering his time for the Cranleigh community. And that's what we feel so privileged, Dr. Hady, not just by your expertise and your professionalism, but how you always reach out to us as a community. We're really appreciative. Now, Dr. Hady, as I said, is having to work from home at the moment. So again, we are so, so grateful for your time. And I know actually how precious your time is. So without further ado, I will go backstage and I'll be back to join with you later for the Q&A, but I'm going to hand over to Dr. Hady.
Thank you, Natasha, for the introduction. Good morning, everyone. I'm not sure I will be able to hear everyone, so I'll just go through my presentation. It should be a funny one, and a very constructive and informative one. You've asked me to talk about our health, how to look after our health during COVID. And I've put together a small presentation whereby I will introduce COVID from a medical point of view in an English way, so that there's no doubts. We've all read a lot about COVID. So I'll take a couple of minutes to talk about COVID, not more than 5 or 6 minutes, about addressing the first two questions, and why is COVID so serious, and why is the lockdown? I don't know if you can see my camera. I'm fitted with a watch because I came yesterday to Abu Dhabi and they fitted me with a watch for 10 days. Why is this lockdown necessary? And then we'll go to the bulk of the presentation, where we address the pillars of health. What should we do for ourselves and for our kids, and how to factor a bit mental health inside, and what are the challenges. And then most importantly is a Q&A where you can address all your questions. Each and every one of us have lots of concerns that they would like to address, and I'm here to answer them. It shouldn't go beyond an hour probably, but in case you need, just go ahead and ask. I have time. Let me start by defining COVID, and this is probably the most accurate picture of or photo of the virus. It's a ball with some proteins protruding from the virus. It's an RNA virus. What's an RNA? Ribonucleic acid versus a DNA virus. So it's a single-stranded genetic ladder, genetic information encapsulated into a thin lining with some proteins on the top. These proteins help the virus penetrate into the cells And these proteins, as much as they help the virus, are going to help us develop a vaccine against the virus. Because if we develop a vaccine against those proteins, we can kill the virus even before it goes into our cell. Now, RNA viruses versus DNA viruses, it's a big topic. I'm not going to go there. Just make sure to, when you hear in the viruses, they say mRNA, antibodies and stuff. RNA is a messenger. RNA is a genetic message sent to the cell. And the virus is as simple as a small genetic message enrolled into an encapsulated that just goes around. It's not alive. It's not dead. We certainly don't know how to define viruses still, but these genetic material, they can do a lot of damage. It's very transmissible. That is for sure. Hugely transmissible versus, for example, the flu. 100 times more transmissible than the flu. It can cause serious health consequences. Now, lots of times I've been asked the question, really, does it need all this fuss? Yes, 1% death rate or 0.5 to 1% is a lot of death, and we really need to take care of that. Take 7 billion, it's 70 million human beings, which is a lot. So we really need to take care of it. I'm gonna go to, so why is it serious? Sorry. If you see on the left a chest X-ray of a normal human being, I'm not sure about the quality of the image that you're seeing, but on the left, there's this X-ray shows normal lungs. I'm gonna give you a bit of education stuff about X-ray. This is the left lung, this is the right lung, and in the middle is our heart. As you see, this black hue of the lung is normal because lungs are filled with air, and they should be filled with air. So you see this black shadow of the lungs. It's perfectly fine. It means we are able to fill them with air. There's no infection. Any infection looks like on the left side. If you look on the right side, if you look here, there's these white stuff, and they signify an inflammatory process, an inflammation. Imagine those small alveoli. They look like small sacs where the oxygen gets through them into our body, and this carbon dioxide exits through them from our body. These sacs, imagine them filled with pus, with inflammation, and that is by definition pneumonia. So why is COVID serious? It's not because we lose the sense of smell or taste, or because of the body aches, or because of anything else. It's just because in the lungs, COVID may cause an infection, an inflammation. The lungs stop the transmission of oxygen. They stop exchanging oxygen to carbon dioxide, and thus we lose oxygen, and we cannot live with oxygen. So we are breathing, but the oxygen, there's no surface to exchange the oxygen. And this is by far was the biggest challenge for all the doctors, how to treat with this, how to treat that. And the fact that COVID started in China, we weren't able to get a clear picture of how patients behave. Like, for instance, at first they said steroids is a bad thing in COVID, and now we know that steroids are the cornerstone of the treatment of COVID. Anticoagulation is not used. Now we use it. So there was lots of getting to know the virus, but now we're at the stage where we really know how to deal with it, but still we are losing lives. Despite all the treatments, still it is a very serious disease. It doesn't cause pneumonia on everyone, but in those people where pneumonia is established, where this infection of the lung is established, the death rate or the severity increases massively, and we need to stop that because really we don't want to lose loved ones. Why the lockdown? Actually, it's to protect the most vulnerable. For the kids, as you say, I've never seen a kid who really had a very severe illness. No, yeah, they have, but I've not lost, God, thanks God, I've not lost any kids to Corona. It's for those people who are most vulnerable, the old, the adults with multiple comorbidities are the ones that suffer a lot. So we need to protect these. We don't want to overutilize the hospitals. The Italian scenario, which is happening now in Lebanon also, there's no space in the hospitals to treat those people. So a normal pneumonia, where and usually we can control it, we can give the patient the best care. When the hospitals are filled, we cannot accommodate that, and the patients will die not from COVID, but from the lack of care that the hospitals give. And for that, we really need to go into some kind of lockdown. Now, what will happen? Well, two things will happen. Either we spread, everybody's gonna get infected, fine, or we will vaccinate everyone. So the issue is either we buy time until we vaccinate everyone, or we let the virus progress slowly so that the hospitals are not overwhelmed with the disease. That's why we all need to accept some kind of a change in our lifestyle, a change in our behavior, in order to give time for the vaccine and in order not to overwhelm the hospitals. Now, each country did differently because we don't know. There's no precedent for this. But I believe in the UAE, what's been done in Abu Dhabi specifically is amazing. It's amazing. The hospitals are always ready. We have always beds and respirators in case we need them, and that is the most important thing. So I don't want to go into more drama about COVID. I just want to go into more, to talk more about how to take care of ourselves, basically in this lockdown. We have to stay more at home. Sometimes we weren't able to get outside, and there was huge challenges, mental challenges, physical challenges, and how to overcome them. And that's what I wanted basically to talk in this talk. So that is probably one of the most problematic things that happened during COVID, a rise in the BMI of the population due to overeating and sitting at home and the lack of exercise. So to talk about our health, I want to show this important thing. Look, there's three pillars for our health: sleep, how we eat, and the exercise. And this is a sacred triangle. However, some people will see it equal as sleep equals diet, a good sleep equals good diet equals good exercise, but in fact it is not. It's not equal. It's more of like this: sleep, then a bit of a good diet, and exercise when needed. You really do not need to exercise for a year in case you sleep well and eat well. And there's the challenge. You cannot sleep a lot and eat nothing while sitting at home. So what happens is the complete opposite of this triangle. What happened in the lockdown, our sleep was rubbish, our food was rubbish, and exercise. Those who have treadmills and who have home gyms, they did, and those who don't really ended up just putting on more weight. So I would really like to stress the fact that sleep is by far the most important thing. Good sleep is by far the most important foundation of our health. followed by a low caloric diet, or let me not say a low caloric diet, a caloric diet that is adapted to our daily exercise. So if we if we use 3,000 calories our day, if we burn 3,000 calories a day and we eat 3,000 calories, that's completely fine. If we burn 1,500 calories a day and we eat 1,500 calories, that's fine. But when things really derail between the diet and the exercise, it doesn't make sense. And you'll see later how these two, exercise and diet, are related to sleep. So what is sleep? I would like every parent to look very carefully on this, to know we start from down. Adults need 7 to 9 hours. Teens already 8 to 10. 6 to 12 years old, 9 to 12, preschool 10 to 13, up to 12 to 16 hours for infants. And that is very important, guys. You can always go back to this, look at the age of your kid, take the average of the bracket on the right, and just understand how much your kid is happening. We have a huge problem with our children, especially from 6 to 18 years old, in sleeping enough hours. Your kid who is 15 years old, he behaves as an adult, he looks like an adult, but really he needs 9 hours of sleep. That's 2 hours more than any one of us. And they don't sleep that much. What happens when they don't sleep? Many things. I'll talk about them later, but please, this is a very important slide. Adapt it to your kids. Why do we sleep less? Why we are not sleeping well during COVID? We are using much more the smart devices. We're using internet, which is a continuous flow of interesting information into our brains. I have done one thing with my kid. We were driving back from Dubai one day, and he's on his iPad, and I looked in the mirror and I could see that he lacks sleep. He wants to sleep. We had a lot of games and stuff. So what I did was I snatched the iPad from him, and in 30 seconds, maybe, he just fell asleep. I'm telling you this to tell you that kids do not need smart devices, especially toddlers, especially young children. Not more than half an hour, 1 hour of these devices per day should be given to the child. And we are sleeping less because we are using more of these devices. Outdoor life also is interesting. Outdoor life makes our body tired. We are tired, our brain relaxes. We're lacking the outdoor life. We're not going out as much as we should, and that leads to more pressure and more stress in the brain. And more stress in the brain is less sleep. The diet also, we are eating everywhere, every time. Coffee in the afternoon. You will see in the tips that I've made for you on how to improve sleep. That diet is a very important part of it. When the body is tired, the brain rests. If you take your kid to the aqua park and come back at home and they sleep in 2 seconds, yes, because when they use the energy, when they use the calories, when they use the ATPs in their body, the brain just shuts down because it needs to reset the energy. And this is a very important thing. We as parents are privileging more and more, okay, take that and shush or run and destroy the house. We need to let them run and destroy the house. Nobody likes it, but this is the natural way of stuff. People who have gardens outside should let their kids play as much as possible. Go outside. In Abu Dhabi, it's open. If you take care of and keep distance, there's lots of activities where the kid can just channel this extra energy that leads them to a better sleep at night. I'm gonna go into some tips for good night's sleep. on how to improve our sleep, and I will start by I'm going to start by something that's very important, which is the biological clock. The biological clock is something that we have in our brain. It regulates our sleep. It tells us when to go to bed and when to wake up. And the first tip is fix your clock. Suppose you want, as adults, to sleep at 10. So if we want to sleep 7 hours as adults and I have to wake up at 7 in the morning, we fix that. Then by midnight, I should be asleep. So 11:30, I'm in bed. If I want to wake up at 8, then you can allow yourself to sleep at 1. But if you have to wake up at 6, you really need to sleep at 10:30. And when you do that, when you fix this bracket, please respect it. And as much as possible, go in those brackets to sleep. Don't go one night at 2, one night at 10, one night at 8, and just react instead of being active. You need to be active in maintaining a nice biological clock. It's important also because all the hormones, as you've seen, the growth hormone are secreted at night, thyroid hormones are secreted at night, and if you don't sleep well, those hormones won't be secreted well, and the kids will really suffer in their growth. We as adults will suffer in our concentration, so on and so forth. We need to avoid electronics. Blue wavelength that is transmitted from the phone and the iPads and smart pads, they inhibit the secretion of melatonin. Melatonin is a hormone that's secreted by the brain to induce sleep. So the best thing before sleep is really to shut down all phones and keep them away. Some patients I have just put the phone next. I don't touch it. I just look at the hour. And get an alarm. It's a small thing that costs 10 dirhams and it doesn't have the blue light. Don't use your phone to check the hour. Certainly don't go through your emails or your social media stuff before sleeping. This is really bad. Reading a book or a Kindle, because Kindle doesn't have a blue wavelength. Reading a book is by far the best thing you can do to yourself or your kids. We need to avoid stimulants. In kids, it could be chocolate and anything hypercaloric. In adults, it's usually coffee, dark tea. Let me give you just a perspective about coffee. Coffee, if you drink a coffee right now, it needs 12 hours to exit the body. So imagine in the afternoon, at 3 o'clock, you take an espresso or a cappuccino. You need to know that this coffee is going to stay up till 3 in the morning. So for those who drink coffee and go to bed, there are some people who just drink coffee and just can shut their eyes and sleep. That's not a problem. But for anyone who is suffering from lack of sleep or inability to fall asleep, we really need to take stimulants out of our afternoons. We cannot have them with us. COVID. During COVID, beds turned into our workplace, our dining table, everything. Really, the bed is for sleeping only, and for married people for something else. But in general, we cannot eat, work, email, even study. For kids, your kids, when they're doing online studies, they cannot do it in bed. They should be sitting on a chair, because we don't want to associate the bed with anything else but sleeping. They cannot have their computers with them. The beds, when we sit in them, the bed's temperature increases and it prevents us from falling asleep. The best thing is to go into a bed that is cold, and that decreases the temperature of our body and induces sleep. This is a very important thing. I've had this during COVID. Everyone is suffering through this. The room should be dark, calm, cold. Some of us, and I know one of you who's a friend of mine, she has a husband who snores. You cannot sleep while your husband snores next to you. You really either need to put ear protection, or you need to treat the snoring of your husband. But in general, having dark outs, no sound, and decreasing the temperature of the room is key to have a good sleep. There are lots of others. Sorry, I'm gonna just take 1 minute here. There are lots of other stuff that we can do to improve our sleep. Meditation is one of them. Doing sports during the day, but not before sleep. So try to avoid doing sports and then going to bed. Listening to calm music. For kids, taking a shower, a hot shower during the day is also beneficial. So on and so forth. These guidelines, these tips, you can find them online. You can find them on our website, hsmc.ae or sleepclinic.ae, I think. But please have a look and read them and try to adapt them as much as you can. It really helps. There are some studies that showed if a person has an insomnia or a sleep problem and he just adapts these environmental changes, in 70% of the case, it will sort his problem out. It's even better than medications. I'm going to go now to the next pillar of health, and that is the diet, and just talk about why diet is important for us. Diets, as much as sleep is important, diet is also very important because it improves our immunity, it promotes muscular and mental growth. And if we don't eat right, it increases our weight, it disrupts our sleep, and it leads to a chain of events where everything gets affected. What is the best diet? And this is a question that I don't dare to go speak a lot about because everyone is sometimes, we have read all of us about it. There's no really specific guidelines. There's something wrong in my presentation, but I think it's just, I'm not gonna fix it right now. So for kids can eat anything, and this is a very important thing. I know some parents will prevent their kids from eating chocolate or carbs or fat. That's totally wrong. Kids need the fat. Fat is essential in the development of our brains, in the development of our hormones, and everything. They need the carbs because they can run much more than us. They burn much more. They have a basic metabolic rate that is really very high. But most importantly, make sure to bring in the vitamins, either through fruits and vegetables, or even there are lots of supplements. Sometimes we can do them. We're not living in a country where we can plant the fruits, and the fruits take time to arrive to the UAE sometimes. So if your kid doesn't like fruits and vitamins, make sure that you supplement it with them, but don't be very stringent on him eating fat and carbs. Now, I'm certainly not saying to eat all the time fatty food and fast food, but if they want fast food once in a while, that's no problem for the kids. You refrain from eating it as a parent, but the kids can eat as much as they want. As for us, our adults, it really is a question of how to manage our metabolism and our weight. Fruits and greens are always welcome. Proteins are essential after sports. You cannot train in the morning on an empty stomach, go back home, and be on a diet. You're just killing your muscles. You really need the proteins if you are practicing. Carbs are not the devil, and this is a very important point. Some people say lots of diets, the keto diet, um, people use it to lose weight. In my practice, I help people lose weight sometimes by even putting some balloons in their stomach to curb their appetite, to stop them from overeating. So I really deal with this on daily basis. A normal diet, nobody can. So when a diet is not sustainable, when a diet cannot be continued, in my opinion, this is a bad diet. I have patients who went on carb, they lost 10 kilograms, then they stopped and went back to the normal diet, and then they put them back again. The best diet is a sustainable one. And the best diet is where you adjust your expectations. If you have an extra 10 or 15 kilograms and you need to lose them, divide them over a year and a half. Put logical goals. Don't say. I once asked a patient who is 130 kilograms. He has to lose around 50 kgs, and I asked him, how much time do you need to lose these? And he said, 6 months. So it cannot be 6 months. 50 kilograms, you need 4 years to lose them sustainably. That is, if you want at the end to arrive to a stage whereby you continue doing what you're doing and not gain weight. So don't cut carbs away from your life massively, but cut down on them. Fats are also needed for our own development, but not. So it's just a matter of quantities, right? And I would love to. Sorry. Okay, I'll get back to that. So I would love to talk a little bit about our diet, what's coming in, what's going out. So in is what we eat. Done. Out, there's two components. One is the basic metabolic rate. So it's what we burn when we are doing nothing. I'm just talking to you now how many calories I'm burning an hour. And exercise is really how much we exercise during the day. Three variables: what we eat, what we exercise, and what is our basic metabolic rate. And a very important point, we can control what we're eating, or can we? We can control how much exercise we do, but what we cannot control is our basic metabolic rate. And this is the unknown in the whole issue. Some people have a lower basic metabolic rate. So if I burn 100 calories an hour doing nothing, and anyone else burns 50 calories an hour doing nothing, and we go ahead and eat the exact same thing, I won't gain weight while that other person will gain weight just because of how much he's burning per hour. And that basic metabolic rate is what we really work on as doctors to improve, to increase, and it's increased by losing weight, by exercise, and by going to your ideal body weight. The thyroid may drop it, anemia may drop the basic metabolic rate. There are lots of diseases that can affect the basic metabolic rate. The doctors usually check for them. But if everything is normal, it's usually how much exercise we do and how much active we stay during the day that leads to the higher metabolic rate. You just also have to know that when we are on a diet, a low-caloric diet, where we're eating less than when we are burning, our basic metabolic rate tends to go down. And that is a challenge in diets that causes plateaus, and it really kills most of the diets. So I'll go now to sports and exercise. So I can see that my assistant have messed my presentation by just I don't know what. So in front of you, you have the two fittest human beings on earth. CrossFit is one of the most notoriously known sports, and this is Matt Fraser and Tia Claire Toomey. They are two beasts of the sport, we can negotiate, we can talk and argue a lot on which exercise is the best. Is it CrossFit? Is it running? Is it cycling? Is it HIIT? Is it Zumba? Is it whatever? Well, really, we do not care. The only bad workout is the one that you don't go to. The thing that is the worst is that if you do not choose to do any exercise. According to the American Heart Association, you need 30 minutes 6 times a week of slow jogging or fast walking. Like your heart rate needs to go up for 30 minutes a day, 6 times a week in order to maintain a good health. Or 4 times a week, 1 hour of moderate exercise is also good. Any exercise is better than doing nothing. So let me put some facts for exercise to just maybe answer some of your questions. Long runs, like I'm preparing for a marathon now, but after that I will stop running long runs because long runs may cause hypertrophy of the heart. High intensity training is good. We have demonstrated that when you do a short exercise, 20 minutes, but with a maximum capacity, this is beneficial. This is beneficial. Your maximum heart rate is always 220 minus your age, and kids need more exercise. I have given my iWatch to my kid, and then one afternoon he'll put 20,000 steps when he's playing with his nephews and his cousins. 20,000 steps in one afternoon. I need to run a marathon to put 20,000 steps. My kid will do them in a couple of hours. So kids, they need more exercise and they do more exercise than us. The last is what am I going to give you as a takeaway message? We need to sleep well. And it's not only the number of hours that matters. You need to really look at those environmental challenges around the hours of sleep, how to fix the hour of going to bed, fix the hour that we wake up, cold, dark room, away from electronics, don't eat before you sleep. Fixing our sleep is the cornerstone of having a healthy life during COVID and in general. The next important thing is fixing our diet, having a low caloric days or adapted caloric intake to our exercise. And the last but not least is exercise. No matter which exercise you choose is good. And that is how we take care of our health. And I hope by this talk I didn't make you fall asleep. I'm gonna exit the mode of PowerPoint presentation and allow Natasha to ask any questions for us. Okay.
Thank you so much, Dr. Hady. I definitely didn't look like that dog, even though I may feel like it sometimes after you're getting through remote learning. Thank you so much. And actually, what I took away personally from that is it was really relatable to what we're going through at the moment. But actually, these are things that we need to carry on doing and following, once this horrible virus, has left us, or at least has calmed down. These are not things that actually are just going to protect us now, but they're going to protect us for the future. And I took that personally, especially from me being a young mum and having to manage, little ones as well. So that, thank you so much. As always, you are able to pass on your message and words of wisdom that are really serious, but in a really nurturing and warm way. I don't know how you do it, but you do. So thank you so much. And that's exactly why the Cranleigh Community Committee wanted you back to speak this year. Just a few questions. I think what's really important is actually, again, like I said, about the importance of how we're being role models to our young families, to our children. And I know you spoke a lot about the devices, and actually you were quite ruthless in the sense of just saying, you know, take it away. There's no discussion. It has no positive impact at the moment. What would you say in terms, I think the biggest one at the moment we're finding, and it's not an age range, but what would you say the biggest thing is with sleep? If there are young children, even teenagers, struggling to sleep, and parents want to have conversations or are having conversations with their children, and it doesn't seem to be working, what would be your top 3 tips to starting that conversation about sleep? Because especially for the teenagers, that's a big one for us at the moment. We're doing a lot internal in school with our counsellor to support the teenagers with, top tips on sleep. But how do parents open up the conversation with their children?
It's a very difficult conversation, to be honest. I see lots of those kids in my consultation with their parents. Sometimes the kids suffer when it's chronic, becomes a challenge because the kid cannot concentrate during the day. And what we cannot do is wait until the kid is suffering. We really need to talk about it and to show the kid the benefits of good sleep and how bad it is to stay on those devices. My son, who is 8 years old, me having a talk with him, it's a dual. He tells me my eyes are burning from the Zoom meeting with the teachers, but when he has a break, he runs to his iPad and watches YouTube. And the thing is, there's so much interesting stuff happening. The flow of information that comes from the internet, it's so high, it's almost addictive. Do you know something, Natasha? There's something called acquired autism. This is a new term in psychiatry. It's called, we all know what autism is. It's a condition where the kid is born and he tends to be alone and with other traits. There is something now happening whereby those kids are becoming autistic by the fact that the only window into life is this screen. So really seriously, I would stop the internet. I would really, as long as I have control over them, do all what's in my hand to stop them from overusing it. Now you need to create also the alternative. You cannot tell him stop it and sit and do nothing. You need to offer other stuff, other activities, going out, because kids really, when you offer him something else outside that involves physical activity, they'll voluntarily leave but we cannot keep them at home, remove these and tell them just to look into the world. That doesn't happen. It doesn't trigger their brain, and their brain needs constant information. So offer the alternative and be strict with that. That's basically it.
And I think also you've highlighted that it's really key that it's all about conversation and dialogue, and it's all also about doing what's right for your family. Obviously, as you said in the start, we have to follow the safety precautions, of course, to keep everyone safe and the government guidelines. But actually, I know I feel it, especially being an expat family over here, that there are different, obviously, expectations from all of us being from all around the world. And I think what's really important is to do what's right. Yes, what's safe, following the government guidelines, but to do what's right for our family and to ensure that actually it's okay to feel comfortable with it's okay that if we have to adapt or make changes and that we're not comparing ourselves to other families. I think that's a real key message. And that's exactly what was, really shining through your presentation today. All of this that we can pinpoint to, but actually it might look different in my family, to your family, to the communities out there and the different parents out there. But we have to feel comfortable that we are doing what's best for our family and our situation, because there's not one size fits all. Would you agree?
100%, 100%. You cannot. So we cannot compare. We are from different cultures. I think what the government is doing here by decreasing the capacity of restaurants, by even the water parks or whatever, all activities by limiting the overcrowding. This is amazing, but it always goes back to you to do what's comfortable for you. If you're a family with a senior at home, with somebody who's old with you at home, you need to behave differently than if you're a young couple with a couple of kids. We don't want to be scared from COVID. We just need to respect it. That's all. I have seen some families who are careless, and that is really bad. And I have seen some families who are just shut down, enclosed in their house, and that is also bad. There are lots of activities in Abu Dhabi that can be done, be it the beach. Saadiyat is amazing. Hudayriyat Island is one big place where you can do our sports with maintaining distance from other people. There are lots of activities. I'm not here but respect it. Don't go all extremes, and there's no sense of comparing each other. Each person has his own settings, his own conditions, and we need to adapt to it.
And since we started our series in September, obviously COVID was still with us then, and it was the start of school for some year groups. We really tried to bring together the support for parents from the mental side, and obviously now you've looked at the physical side. And I think it's important to say now, with you being here, because I've known you for a few years now, and you do link the both. They have to be linked together, the physical and the social and emotional, and we can't look at them in separate kind of capacities, because it forms who we are. And I would just stress to parents that all of these talks that we've had, please do not see them in isolation. You've covered some of the, mental brain breaks, or some of the things that we can do to actually preserve our mental health as well. And what would you say, Dr. Hady, as a last point in terms of the connection between the physical, social, and emotional? What's your viewpoints, and especially in your role?
Mental health is key to everything. I'm going to give an example of a person. So many of us do not believe that our mental well-being is connected to our physical well-being. I'm going to give you an example of a patient who once I saw in the emergency room, who was just hit by a guy, just slapped. And she had 40 degrees temperature because of the stress. Because of the stress, she had no infection, no inflammation, nothing. She was totally fine. Just had a fight with her boyfriend, and he just slapped her, which is very bad. But her fever was 40 degrees. Guys, our mental health affects our immunity, our basic metabolic rate. When we're happy, we burn more calories. When we're sad, usually the body shuts down. Our immune system is affected. We can catch the virus more. We are prone to disease more if our mental health is suffering. We sleep worse. One of the insomnias, it's called type B insomnia, where we can fall asleep, but we wake for an hour or two in the middle of the night, and then we fall asleep at the end of the night. It's completely related to anxiety and depression. And if we do not incorporate, if we don't take care of our mental well-being, we cannot gain on other fronts. It's like our body is not a combination of many things. It's one melting pot of different stuff, the physical, the mental, and other stuff. So yes, I agree 100% with you, Natasha.
Yeah, and I think it's important before you leave to say that, especially to those families that are listening, we have a lot of families that listen after work to all of our sessions, that, continue that dialogue, continue that conversation, whether it be someone at home, whether it be someone in the community, whether it actually sometimes be someone that you don't know that well, because actually it's a blank canvas, and it's that kind of non-judgmental kind of sounding board. Please do reach out. Thank you so much, Dr. Hady, on behalf of the Cranleigh community. I hope that we do have you back next year, and actually that we can, go back to our Saadiyat Beach Club, have our coffees, and that hopefully we won't have to be talking through a camera screen. As always, you're so positive, optimistic, and just thank you on behalf of the Cranleigh Community Committee as well. It's been an absolute pleasure and a delight. And I can say that you know, I too go to the Harley Street Medical Centre with my daughter, and all of the doctors and nurses and all of the administration there are just phenomenal. So I can't recommend you guys highly enough. So stay safe. I hope you get the tracker off nice and quick. You're stuck with that.
This is really, but what we do, we need to respect the law. Natasha, thanks a lot for this. I would like to thank Samar also, who helped organizing also all of this. Stay safe, guys. Enjoy life. And I believe, look, I can say by summer, things will really change positively. By this summer, as soon as this second wave goes off, we'll go back to, I'd say, 80–90% of normality in our lives. So keep your hopes up, and see you next year, hopefully, or before if needed.
Thank you, Dr. Hady. Stay safe.
Bye-bye.